Hello, everybody. Welcome back to I believe it's our third in our little series here with Kathy Enking, nutritional therapy practitioner and Bachelor of Nursing. Thanks for being here again, Kathy. I'm so excited.
Yeah, this is great, Katania. This has been a really fun surprise having just met you and doing these talks together, coming out of Reno here, and it's so exciting to meet like-minded people, for sure.
I love it, and I love that you like to do these because it just makes them so much more fun and bouncing the ideas off each other and all of your great knowledge and everything. So today, honestly, I feel we were just talking about this before we went on the air that if people did see that I, put this up about 4 hours ago, possibly they saw that we were going to be talking about cavities today. This is a really big thing what I want to say is that I wouldn't be surprised, honestly, Kathy, if not very many people jump on. And here's why. We don't worry as much about our mouths and our oral health as we should. And, I do focus a lot with kids with cavities, but bleeding gums or receding gums and root canals, all Americans, it's one of the top diseases. General oral health and oral disease is one of the top diseases in our country. And cavities is actually the #1 childhood disease in the United States. It's really frightening. And despite obviously, supposedly statistics say that 50% of children in the United States don't see a dentist regularly, which is very sad and tragic. However, those of us that are seeing dentists, I believe most of us are seeing, most of my friends and colleagues and clients and patients, their children are seeing the dentist twice a year. And yet cavities are on the rise. So it's not necessarily reflective of the less fortunate that are not able to see the dentist. The problem is, and this is where this falls in perfectly to everything we've been talking about, Kathy, is that it is on the rise for other reasons. Cavities and oral diseases are on the rise, and I believe it's all nutrition based.
Yeah, absolutely.
So that's why this is perfect for us today, and why I say that, if people see sort of the title of this and possibly don't jump on, it's because I don't think people are, unless they have an imminent, their tooth hurts or they need a root canal, something's really going on with them, people don't worry about or focus on their oral health.
And sometimes I think it's like medicine is here and then dentistry is over here. It's like many things, the way that we look at the body, we don't look at it as one organism. We think we got to go to a doctor for this, another doctor for that, another doctor for this. And when, it's easy to think about the mouth as being just this separate thing. Yeah.
Yeah, it is absolutely, unfortunately, the way we look at all of medicine in general, and dentistry falls right into there as well. And the fact that we don't consider our mouths as part of our bodies, even those of us who are holistic, you had even asked, why aren't naturopathic doctors more into some of the stuff we'll talk about today, some of the research I've done. It's just not the forefront of medicine and dentistry right now. Some of the theories that I'm going to talk about today are just not the forefront. However, holistic doctors and naturopaths and such are certainly looking at oral health more closely. It's no surprise to us that there is an oral microbiome, for example. It's no surprise to us that mouthwash is killing that, and antibiotics are killing that. And so it's really not surprising to most of us that are in the alternative health field, but I definitely don't think there's not enough knowledge and information and study out there right now. So it's still, it's still a sort of an unfounded territory, an untapped territory that I've been passionate about for a long time. I finally have created a program around this. So we'll talk about that a little bit more towards the end, but I just find oral health is, and especially with kids, but with everybody, oral health is so important and so overlooked. And that in continuing to talk about all these wonderful nutritional therapies that we have been talking about, that you and I both agree and believe in, it's really all the same thing, which is really cool, that we can heal our mouth and prevent cavities with a lot of the nutritional, pathways that you and I have been talking about that are, Weston A. Price, paleo type diet, nutrient dense diet. So that's what I want to get into today. So I'm really excited about it. I just love this. I wanted to, I think I told you, but my story on the cavities, the reason why I got into this, I'm an acupuncturist, an oriental medical doctor, a functional medicine doctor. Why the heck am I talking about cavities? My story is that despite what I thought was a very healthy diet for my children, but mostly my son, who's now 12, breastfed till a year and a half, really, I felt he ate very well. He had at the age of 4, was diagnosed with 6 cavities. Now they were between teeth, and I believe his teeth were tight. They were tight together. So that doesn't help. You get food stuck, and we probably weren't flossing early enough. And there was a number of things that we probably weren't doing right. But certainly what I know now is nutrition. Even though we were eating quite well, nutrition, we had too much sugar in our diet. He was drinking too much milk out of a bottle before his nap at night, too many different times. And he's now 12 years old and has not had a single new cavity. And, so that's really, really big. I grew up with a lot of cavities. I always thought of it as like, well, my teeth are soft. You just, whatever. There is certainly a genetic component to this. But as you and I will talk about, the nutrition component, the epigenetic component, where we don't necessarily need to fall into that genetics that we think, oh, our grandmas had bad teeth, our moms had bad teeth. We can make some changes there with nutrition because of epigenetics.
And Katania, I remember too as a child, just because you mentioned that, bringing that up, is like, I was the same way. I had a lot of cavities as a kid, and nobody ever sat down and had that conversation with me or my parents about talking about sugar and how much sugar. And then you'd go to the dentist and you get a lollipop afterwards, as a prize for being good or whatever. So like the connection was just not being made at all.
Yeah. So on that note, let me get into a little bit of the history on, and then we can get into the nutrition part, because some of these researchers and scientists and dentists end up overlapping with things like Weston A. Price and the nutrition component. So some of the history on, so the research that I've been doing on cavities, back in about the 1940s, there was basically a decision made. The Dental Association came together and they said, we need to decide what we're going to teach in dental schools and what our theory on cavity is. And they basically decided on the acidogenic theory of cavities, which is basically the topical theory that, we hear now. We do hear about sugar from the dentist, but we're hearing it in the sense of, if you eat sugar, brush it off right away. And then we also hear about acidity and acidic drinks, because acidity eats away at the enamel. So those are the 2 basic things we're hearing about from the dentist. It really has nothing to do with what that sugar then does once we swallow it, or any of that. It's really a topical, based in our head, based in our mouth, and sort of that our teeth are almost like stones or rocks in our heads that they're not alive, they're not connected to the body, but we want to make sure we don't let anything touch them, or if we do, we brush it off, and that's it. And so it's really leaving out a huge systemic problem that we can address that gives us a lot more, control over it. But what I want to say, getting the lollipop at the dentist office. Even today, if you have a little bit more forward-thinking dentist, you might get xylitol mints, and that's a little bit better. There is a theory that xylitol can inhibit somewhat bacterial growth. It's kind of controversial, but if you have a little bit of a progressive dentist, you might have that. But basically, the bottom line is, if you eat sugar, you need to brush it off, and you need to avoid Cokes and that kind of thing, because having that in your mouth is going to eat away at your enamel, and then that's done. End of story. We stop right here, right?
Mm-hmm.
So going with that acidogenic theory, that's how dentists were then, from the 1940s on, taught in dental schools, basically around that topical theory, acidogenic theory. Well, around the same time in the 30s and 40s, there were a number of different things going on. One of them was a dentist named Dr. Steinman, and he's similar to Dr. Weston A. Price. He started seeing the decay and the degeneration in his patients in his dental practice. And he basically left his dental practice to do research. And he started researching, and he needed an endocrinologist to help with his studies, because what he found was that there are so many different endocrine functions and endocrine, contribution to the health of our teeth. What he found in his studies on rats over 20 years, they did thousands of studies, is that there's something called a dentinal fluid flow. It is a flow. So we have a blood flow, obviously, to our teeth. There's no controversy to that. They are living as far as their roots. We have blood flow to the roots, but then there is these thousands of miles of dentinal fluid flow that's basically a lymphatic flow that flows all the way through all of our teeth, all the way to the surface of our teeth. And when it's flowing in the right direction, it's flowing outward, and it's cleansing and protecting. So it's not letting anything in. It's the enamel is even porous. It's actually almost like sweat beads on the surface of our teeth. He did studies where he actually saw a radioactive dye. He injected it into the stomachs of rats. He was able to see this dye come out on the surface of the teeth. So it's absolutely fascinating. And so what he found was that this flow, as long as it's flowing outwards, is protecting and literally rinsing. If it reverses, things are allowed in, like the acid, like the bacteria. Not only that, but that's where we get the nutrients to feed the teeth. So we want this outward flow, and then we want the nourishment that comes in from our diet. So one really important thing is blood sugar levels in our blood. Now, another study he did was like a feeding tube, he put sugar or sugar water directly into the stomach of the rats that he was studying, and they developed cavities. He found that what happens with blood sugar levels is that it disrupts the endocrine system. It tells the hypothalamus to give a different signal to the parotid gland. The parotid gland then sends a wrong or a dysfunctional signal to the odontoblasts inside our teeth that reverses that fluid flow, then allowing sugar and bacteria and yeast and fungus and anything else in our mouth to be pulled into the tooth. The other thing about sugar levels in the blood is that when your sugar levels are high, your phosphorus and other minerals are lower. So we've got two things going on that we want to talk about: nutrition and getting that phosphorus, the magnesium, and the vitamin D and all those nutrients into the blood. But the blood sugar level, it doesn't even matter if they crosses your mouth. You can inject it straight into your gut. Blood sugar levels are affecting cavities, whether or not you brush your teeth immediately or not. It is absolutely mind-blowing. So that's where I want to get into the nutrition with you. And again, we talk so much about sugar, but this is totally bypassing the whole theory of acidity on our teeth.
That's astounding. I didn't know about those studies, and that it makes so much sense.
Absolutely.
It's super fascinating.
So then those overlap with a couple of other dentists that were studying nutrition. One being, and I'll have you sort of tell us a little bit about Dr. Weston A. Price. But those studies overlapping with a lot of these dentists that are finding about nutrition and the degradation of our nutrition that was back also in about the 1930s. This is all sort of transpiring. So tell us about Weston A. Price.
Yeah, so for those of you that haven't tuned in before, a little bit about Weston A. Price, and here is his book, Nutrition and Physical Degeneration, which still is, but was thought to be one of the most forward-thinking books on nutrition, especially of its time, and people still today refer to it. And what was fascinating about Weston A. Price was back in the early turn of the 19th century, he was a dentist. And what he started noticing was that people who were coming to his practice, that people's teeth were getting worse and worse. And he noticed that it was as people increased with what he called modern foods, meaning white sugars, white flours, and white foods in general, that the incidence of dental caries went up. And what he found was that each generation, if the families continued to eat that type of a diet or incorporate those foods in their diet, their health became significantly worse with each generation. And so he traveled all around the world to 7 different continents. And what he was doing is he was looking for indigenous cultures that hadn't been impacted yet by trade and modern commerce and these white flours and white sugars being incorporated into their diet. And so he went to remote parts of Africa. He went to valleys in the European, in Europe that had never been touched by modern foods before. And he went to, all different cultures. And what he found was that the cultures that had not been touched by the modern foods had perfectly formed teeth. The children were healthy, they were robust, they had all of their teeth, and they had very wide mouths. And even though they might have had a few cavities, and these cultures, they did not have floss and toothbrushes and toothpaste. Mm-hmm. So, they weren't doing that. They weren't rinsing their mouths with, Listerine or whatever we tell people to do. these days, they were just living their lives, but they also were eating the foods that were indigenous to those cultures, and they weren't eating a lot of sugars. In fact, they had never even really heard of or seen sugars. And what he found again was that these cultures, the children had really, really incredible teeth, the parents. And then for the communities that started incorporating the white flours and the white sugars, was they had a slow degradation in their health. And I think I even remember reading a story that he put in about a set of twins. One of the brothers stayed in the original community that hadn't been touched by this modern commerce, as he calls it, and one of the twins went to the city, and he started incorporating these modern foods, and they compared their health over time. And the one obviously that stayed in the original valley, his health did not degrade to the degree that the brother who went off and was part of our modern civilization. And I hope it's okay. I wanted to read this quote from the book, which I kind of just opened to this morning as I was looking over this book again. And okay, so now the first publishing of this book was 1939, right? So, and this is nothing new today. He says that modern man is declining in physical fitness has been emphasized by many eminent sociologists and other scientists. That the rate of degeneration is progressively accelerating constitutes a cause for great alarm, particularly since this is taking place in spite of the advance that is being made in modern science along many lines of investigation. So I think that statement is pretty true today, for sure, as it was even back then. And it just seems like we keep making these advances in modern science, but our health isn't getting any better. And so that's why I think this topic today is just so perfectly pertinent. And as we talked about just a little bit earlier, the mouth is like that window into what's actually really happening inside of the body. And so, incorporating these, those are staples in our diet now. Sugar, white foods, white flours, white bread. They're pretty much staples in our diet. And so it's having a tremendous effect on our health as a species. And depending on where your level of genetic, disability is, that's the disease that's going to manifest. But I think that, it'd be so cool if we could see more and more dentists like really making statements about, they can really look at your mouth and determine your health from, what's going on inside of your mouth. Yet I've never really heard a dentist have that conversation with me.
Right.
Nothing against dentists at all, for sure. But, I don't know, when are we going to start making that connection?
Yeah, they're still compartmentalizing, and the science doesn't always reach. I think we've talked about this too. The science is not necessarily reaching the doctor's office for many years, 17 to 20 years actually. And it's happening, it's the same with dentists, and so, but what the scientists are finding is that not only is bad oral health causative of other diseases, those other diseases are also going to be causative of oral health. So we really need to be watching our mouths, taking care of them. If we have a little bit of bleeding gums or recession, these can lead to bigger problems. There's very clear studies showing a connection with plaque and bacteria and bleeding gums leading to and being corroborated with heart disease. They're finding some of the similar bacteria and inflammation that's going on in the mouth. They're finding those in arterial plaques. Mm-hmm. And then when you have those bacteria and those toxins in the systemic blood supply, that's causing, it's systemic inflammation, which we know is the root of all diseases. So if you have inflammation in your mouth, which is indicated if you have bleeding gums, sore, painful, receding gums, you have inflammation. And, this is so clear, having pain is inflammation. So we have certain harbingers or indicators that there's inflammation or issues going on in our body, and our mouths are really, really a big part of this. The other really interesting thing, both on the positive and negative side, is that our oral mucosa is only one cell thick. It's very, very thin. And so not only can it absorb everything, including all the toxic toothpaste and mouthwashes that we're using, they also are very easy to bleed, but they're also very easy to heal. So, it's a good and a bad thing, and they can heal very fast. But what we need to do is, look at the nutrition, look at our digestion, the oral microbiome in the mouth. So if you've got gut issues, you can assume you have an oral microbiome problem as well, because they're all connected. If you're taking antibiotics, hopefully you're being told to take probiotics, but if you're swishing with an oral antibiotic, or you're swishing with any mouthwash is going to decimate the oral microbiome. So really what we want to do is kind of stop all that harsh treatment. Just like we're starting to realize we want to be careful with antibiotics in our guts, we want to watch some of that topical craziness going on. And then
as a little addendum to that, when you have bad breath, or I'll come across people who have really horrible bad breath, it's not about just rinsing out your mouth and getting rid of, that to me, it's right away is a reflection that there's something going on in that gut. There's definitely inflammation in the gut. So that's like just a really simple thing that I pick up on when I see people. And if they've got bad breath, I'm like, ooh, there's something. And a lot of the cancer patients that I see too, halitosis, it's quite common.
Right. And that's coming from deeper down generally.
Exactly.
Because it's connected. We can no longer look at our mouths as separate. They're right next to our brains. They're right next to our eyes and our ears. They're connected by a tube to our entire digestive tract. They're totally connected, and we've got to start paying better attention to them. So let's talk about, let me answer my friend Laura's question really quick. Yeah. She says, Weston A. Price makes so much sense. What is the best resource for general information on this diet and lifestyle? Well, Laura, I have developed my program. It is based on a Weston A. Price type diet. It is a pretty simple program. I go into just those missing nutrients that some of these scientists and some of these dentists, including Weston A. Price, found we need in our diet. Even if, some of these dentists did some research where all they did, and I don't want to promote this, but really they just added a few nutrients into the diet, and they could prevent quite a few cavities even if people didn't change their diet. So things like vitamin D3, magnesium, phosphorus, if they upped some of those, even in supplemental form, they didn't need a huge change in the diet to see some improvement. Now, if you drastically change your diet and add these supplements, you're going to really make a really big dent. And that's what my program is doing. And then the book that you just showed that book again. The Weston A. Price book is a fabulous one. WestonAPrice.org is the website for that book. I'll write that down. But Kathy, talk a little bit about what Dr. Price found with fat-soluble vitamins.
So, a lot of what we've been talking about the last few weeks is about sugar, really, and how such a detriment it is on our health. And there's basically our 4 fat-soluble vitamins. It's vitamin A, vitamin D, vitamin E, and vitamin K. And what they found was that the best sources for those 4 different fat-soluble vitamins is actually animal products. And that's why we're not necessarily big proponents of a vegetarian diet, even though we know that it is really important to eat lots of vegetables, for sure, because we get a lot of our trace minerals and other things from that. But that the fat-soluble vitamins, vitamins A, D, E, and K, were most easily utilized by the body in the form of animal products, whether it be from meats, organs, eggs, poultry, fish, things like that. And that our body could utilize those nutrients, those fat-soluble vitamins, to such a greater degree in that form than they can get. There's a lot of talk about, beta carotene, which you get in, basically vegetables, dark orange and yellow vegetables and things like that. But that's a different type of vitamin A. That's a beta carotene. And the body can use some of that. But what they found too is that young children, and actually before the age of 2 years old, their bodies actually cannot convert that particular beta carotene into a usable form. And actually sometimes you see pictures of babies' skin turning orange because they've been fed lots of carrots and squash and things like that. And it's because their body is not converting it. And so for brain development, for neurological development, those vitamins, those fat soluble vitamins from an animal source, are so incredibly important for growing young children, bones, muscles, brain tissue, all of those things that we're looking at. And you just cannot get it from, vegetables. Certainly that's much better to eat than sugar. But if we look back to or if we look right now at a lot of our children's diets, they're just laden with sugar. And children are not getting the proper nutrition that they need from these healthy fat soluble sources and these vitamins that are so important for all kinds of cellular processes that are going on when they're developing and growing from such a young age. And it's important as we age too, even fat soluble vitamins for the aging brain, as we're hearing more about MS, Parkinson's, Alzheimer's, all these neurological conditions. We start taking away those fat soluble vitamins and we have, very little to support that myelin sheath, which lines the entire neurological system. So these fat soluble vitamins are really, really important, from a young age and then as we're getting older.
And let's talk a little bit about why this has happened. So number one is the low fat craze, basically, in this country for the past 30 or 40 years, I would say, is one of the biggest. And with that came the fear of butter, eggs, animal fats, which not only contain the nutrients with them, but
I'm going to plug in my computer. Sorry, it's going to go to sleep.
The key with eating these fats is that it also helps you absorb these nutrients from other foods. So there's kind of a dual process going on with fats. We don't want to limit fats in our diets, but we also, then where we get these fats, in order to have them high in nutrients, is grass-fed butter, the cows eating on pasture, the animals are pasture raised. I mean, the fats actually contain vitamin K2 and vitamin D3, the actual fats of the animals, the dairy of the animals. Eggs are a huge, fabulous, the egg yolks have tons of these vitamins in them. So one of the really big things, and I go over this in my program, we've lost these foods most primarily from the low fat craze. And then the number two reason we've lost a lot of these nutrients, and this is a little harder to tackle, is that we no longer eat nose to tail. We no longer eat the whole animal. We do not eat any organ meats anymore. And these organ meats are really a very high source, especially the liver, the heart. They're very high sources of vitamin D, vitamin K2. So we need to be thinking about, how humans have eaten for hundreds of thousands of years and how we've been eating in the last 80 years. Is very different. And that is really the key thing here. Our sugar's gone up, our fat levels, fat sources, or fat content in our diet has gone down, quality of our foods have gone down, and we're no longer eating the whole animal. So we're not eating, fish eggs, and we're not eating, there's just so many things that used to be a delicacy that for a reason for hundreds of thousands of years, they were eating the liver. They were giving the liver to women who are trying to conceive. There was, caviar was being given to people who were trying to conceive. There was these vital foods, these like spiritual foods that were given to people who were either ill or they were trying to conceive, or children, because that was the only way that 200, 300, 400 years ago, 1,000 years ago, 10,000 years ago, humans were surviving because they were eating well. And because they didn't have modern medicine, so the only way to survive and perpetuate the species was to eat the right kinds of foods and get the nutrients, and they knew how to do that, and we've lost that. Are you there? Are you going to be able to hear me?
Yeah, no, I'm good. I had to plug in my computer. I noticed that I was gonna go to sleep.
Yeah. So, just not to go to, we wanted to kind of keep it to 30 minutes today, and we could talk forever about how to get these fat soluble vitamins. But again, just sort of going back to what we've talked about the past 2-3 weeks, those fats, healthy butter, Kerrygold butter, grass-fed butters, healthy animal fats. Don't feed your children low-fat diets. And then you get your vegetables and you put your fat on there, and you've got the best of both worlds because you're getting the nutrients out of the vegetables that the fat is helping you to absorb.
Exactly. Yeah. And also, just to add in conjunction to that, really what we're, everything that we've been saying in these last few videos, it's just kind of all coming together. And, what I was going to say was that we've seen that, like, to me, it almost looks like it's kind of a fad right now that bone broth is coming back into, you know, into our diets and stuff. But I don't think that's a fad. I don't think that's going to go away. I mean, people are really embracing the level of nutrition that you can get from bone broths. So you're getting, you know, the minerals from the bones. You're also getting some of the fat soluble vitamins, and you're getting it in a form that is very easily utilized by the body. So yeah, so that's a, you know, that is another way that we can get a variety of some of these fats too, is from bone broths.
For sure. And collagen is also really essential for oral health. It's essential for the gums. It's essential for the ligaments in the teeth. I mean, our teeth are held into a bone, and it's almost like they're a joint as well. You know, they need that collagen. That's another really biggie. Yeah. So, so yeah, just basically the sugar sitting on our teeth, we want to brush that off. But, you know, just because you send your kids to go brush their teeth after Halloween, those cavities are forming because of what's going on in that blood sugar, what's going on with the minerals in there. Even if you're feeding them a high mineral diet or a high mineral meal, having elevated blood sugar is going to counteract that. So we really need to be caring about our oral health, and we really need to keep pointing out, Kathy, how detrimental sugar is everywhere in our bodies. You know, we can't just brush it off.
Yeah, exactly.
Really.
Yeah.
All right. Well, let me just put up my program, because like I said, I go into all of this in great detail, from nutrition to, you know, how we can keep this dental fluid flow flowing in the right direction, how we can nourish that fluid flow, protect our teeth, reverse small cavities even. You know, we can prevent, but we can also reverse little ones. We can prevent infections and bleeding gums, and even root canals. If we have, you know, healthy teeth and a mouth that can fight infection, we can prevent a lot of these invasive, you know, oral procedures as well. So check out my program, and it's simple. It's, you know, it's just doesn't take too long. There's 2 lectures in there, and I'm really passionate about this. And, you know, like I said, this is a way to not only prevent all this oral health that is predominant in this country now, but this is a way that Kathy and I are talking about eating anyway. So you're going to kill 2 birds with 1 stone. You're going to help your oral health and the rest of your body as well. So thank you, Kathy, for being here. We might have to keep going, you know, deeper and deeper into.
I was going to say, we haven't even talked about fluoride. So
I know.
Some thoughts about that. So
oh, I do, for sure. Yeah.
Yeah. So maybe we'll have to continue this discussion. Yeah.
Okay, well, everybody jump on whenever you can. Ask questions. I'll be coming back. Kathy and I will be checking back and answering questions. Check out my program. It covers out all of this in detail. Absolutely. And thanks for being here, everybody. Thanks, Kathy, so much. Have a great rest of your day.
You too, Katania. Thank you so much.
Okay, bye.
Bye-bye.